COVID-19 vaccines were first rolled out in the Philippines, the goal was clear. Protect as many people as possible and bring the pandemic under control.
Mamili kayo, magpabakuna kayo o ipakulong ko kayo sa silda.
But as the vaccination started, so did the reports of people dying after getting their shots. One of the cases involved, a police officer from Manila district got his first Sinovac dose. A few days later, he tested positive and eventually died. Officials said it wasn't the vaccine, but this time, people started thinking twice. In Ireland, a young footballer died 5 days after getting vaccinated. In another case, a healthcare worker who died not long after getting vaccinated. Officials said the person already had COVID-19 before the shot, so the vaccine wasn't to blame.
The Department of Health stressed that the healthcare worker died due to coronavirus disease and not due to COVID-19 vaccine.
Many couldn't help but ask, are we really sure?
Ayaw ko po. Baka hindi kayanin ng dugo ko. Baka magkasakit pa ako eh.
Siyempre medyo natatakot kami. Hindi namin alam kung ano magiging epekto niya sa amin o side effect. Kung meron man, medyo takot kami.
Even then, health officials repeated the same message.
Hindi po lahat ng namamatay dahil sa pagkakabakuna ay dahil dito sa COVID-19 vaccine. Not all of this are causally related dito sa pagbabakuna natin.
The deaths weren't caused by the vaccines. Same story. Before we get into all of our social media bullies, I want to go over the 4 biggest lies about the COVID vaccine. COVID lie number 1. Vaccines completely stop COVID-19 transmission. They do not, absolutely did not, provide sterilizing immunity that prevented all infections from the onward spread. COVID vaccine lie number 2. Natural herd immunity is inferior to vaccine immunity. Let me take a second here. Studies showed robust, often superior immunity from prior infection, but this was ignored. Ignorance. COVID vaccine lie number 3. Vaccines have no significant side effects. Alam na natin lahat yan. Katangahan lang yan. COVID vaccine lie number 4. The worst of them all. It's time to call out all the folks who are speaking and so sure of themselves when the world was at an uncertain time.
Takot na takot sa COVID pero anti-vaxxers. Di ko mag-gets yung logic ng utak.
Sobrang low IQ nito. Itong tao na to ay walang kwenta. I feel bad for you. Parang kawawa ka. Kawawa kayong lahat. Not everyone deserves to be respected after all the shit they said about Sinovac. Paulit-ulit ka lang without even thinking, researching, or understanding.
Kahit anong brand pa ng bakuna yan, basta inaprubahan ng FDA, equal footing o pare-pareho ng effective at safe yan.
Joey De Leon, maybe you didn't know, but tong statement na to ha, the FDA, the WHO, those are paid organizations who don't give a fuck about people, only profits. Sure, Joey De Leon, you've been in the public eye for a long time now. You're supposed to be smart.
After daw ng 14 days, after 14 days, may 25% na ako na panlaban sa COVID. Is that right?
You didn't even know what the hell you were talking about. You were asking him, tama, di ba? Yung 14 days, 7 days, tama, di ba? Katangahan to. This is what was happening. This is the problem. Katangahan that I hope that we never ever repeat. Katangahan, gago, Willie, Revillame.
Brandon Vera is the single greatest Filipino mixed martial artist of all time and the second most globally impactful Filipino fighter ever after Manny Pacquiao. He went to war a breathtaking 27 times over 2 decades, spending more than 214 minutes and 29 seconds locked in a cage eye to eye with another professional killer trying to put him in the hospital. He's also the only Filipino to ever win a major title, having gone undefeated for over half a decade as One Championship's heavyweight king of the world. But Brandon's fight didn't end in the cage after he retired at 45. He's also known as the OG anti-woke Filipino celebrity, one of the first to openly speak his mind on scalding hot-button issues, from the COVID vaccine to trans women in women's sports, from Israel versus Palestine to the Epstein files, from how money is created out of thin air to how wars are started for profit, to the lengths at which the most powerful people in the world go to get what they want. Brandon was one of the first Filipinos to proudly and publicly call it all out and push people to think freely. He spoke up against the woke BS at a time when it wasn't cool. He did it when it was difficult. He did it when it was dangerous. That's because Brandon Vera has always been an honest man. He doesn't care what you think, as long as he speaks the truth. And today, the truth is proudly PGMN.
I didn't know what I wanted to do after fighting, but I still wanted to fight.
You just witnessed the truth's very last fight in MMA. I love you all. Thank you for everything you've given me, MMA. One championship.
So, thank you for having me here, PGMN. It's time to call out all the folks who are speaking and so sure of themselves when the world was at an uncertain time.
Mamili kayo, magpabakuna kayo o ipakulong ko kayo sa silda.
Lahat kayo vaccinators, eto na para sa inyo. For speaking out, I got slammed every day on my social media.
Don't be anti-vaccine, man. Lots of smart people say vaccine is cool. Let's trust smart people.
You've taken too many punches.
Unless what you're reading are peer-reviewed journals, then you're reading the wrong shit. You have a wide audience, Brandon. Be better than that.
Everyone, management, sponsors, endorsements. I don't really work for anybody, huh? I kind of work with people. And people that I was working with, billion-dollar companies, told me that I didn't take stuff down. Back then, people were getting paid, and I was going broke. To all those people that gave me shit, gave me a hard time, and did not have my back, fuck you! Today is a day for reckoning. You will be called out. I did not forget, and I kept receipts. Let's roll. When the COVID-19 vaccines were first rolled out in the Philippines, the goal was clear. Protect as many people as possible and bring the pandemic under control. But as the vaccination started, so did the reports of people dying after getting their shots. And while health officials were quick to say these deaths weren't caused by the vaccine,
And the Department of Health stressed that the healthcare worker died due to coronavirus disease and not due to COVID-19 vaccine, based on the investigation conducted by the regional and national AEFI committees.
many couldn't help but ask, are we really sure? One of the cases involved a healthcare worker who died not long after getting vaccinated. Officials said the person already had COVID-19 before the shot, so the vaccine wasn't to blame. But since there weren't any or many public details and no independent autopsy results, people were left wondering.
Ayaw ko po. Baka hindi kayanin ng dugo ko. Baka magkasakit pa ako eh.
Siyempre, medyo natatakot kami.
Bakit?
Hindi namin alam kung ano magiging epekto niya sa amin o side effect kung merong man. Kaya medyo takot kami.
In another case, police officer from Manila district got his first Sinovac dose. A few days later, he tested positive and was hospitalized and eventually died. Again, officials said it wasn't the vaccine. But this time, people started thinking twice.
Hindi pa ako sigurado kasi.
Bakit po?
Kasi sir marami akong naririnig na nakakasama daw sa sa katawan yung bakuna kung hindi pa talagang sure na gamot siya. Kaya natatakot ako.
Later on, the Department of Health confirmed that 24 people had died after being vaccinated. Most of them were elderly or had pre-existing conditions like hypertension or heart disease, which prompted an investigation. Even then, health officials repeated the same message. The deaths weren't caused by the vaccines.
Kailangan kapag pag tumitingin tayo ng datos, iniintindi po natin. Mismo dun sa website ng FDA, nung una pa lang na ipalabas ito, sinabi dun sa website, there is this specific number of deaths after being vaccinated. Pero merong kaduktong na phrase yun na hindi ini-include dun sa mga nilalabas sa media. Nakaduktong dun, nakasabi na ito ay depending pa at pag-aaralan if it was causally related to the vaccine. So ibig sabihin, hindi po lahat ng namamatay dahil sa pagkakabakuna ay dahil dito sa COVID-19 vaccine. Not all of this are causally related dito sa pagbabakuna natin.
Same story. Even though some of the cases were still under review. It wasn't just in the Philippines either. In Ireland, a young footballer died 5 days after getting vaccinated. Authorities didn't blame the vaccine, but the coroner still made several recommendations to improve post-vaccination monitoring. There was also a review of autopsy reports from different countries showing that although rare, some deaths after vaccination did involve signs of inflammation, myocarditis, and blood clots. The review didn't say the vaccines were the direct cause, but it did call for more research and better reporting systems.
I regret getting the vaccine, even though I'm a 52-year-old woman, because I don't think I needed it. I think I would have been fine. I'd got COVID many times, and it was well past when the vaccine was doing what it was supposed to be doing. And then for the first time, I tested positive for an autoimmune issue at my annual physical. And I went to the best rheumatologist in New York, and I asked her, do you think this could have to do with the fact that I got the damn booster and then got COVID within 3 weeks? And she said, yes. Yes, I wasn't the only one she'd seen that.
For decades, the standard for vaccine development has been clear. It takes 12 to 15 years to confirm safety for general use. But with COVID-19, they rushed the vaccines to market in just 9 months. Soon after, stars in Hollywood and Philippine showbiz jumped in aggressively, pushing everyone to get vaccinated, even kids who faced almost no risk of dying from the virus. One of my heroes, somebody I grew up with, Arnold Schwarzenegger, put it bluntly.
Put that needle down.
All done.
Thank you.
You're welcome. Congratulations.
Thank you very much. Thank you.
Thank you.
Absolutely. All right, I just got my vaccine, and I would recommend it to anyone and everyone. Come with me if you want to live.
Fuck your freedoms, he said.
But I think people should know there is a virus here. It kills people, and the only way we prevent it is to get vaccinated, to wear masks, to do social distancing, washing your hands all the time, and not just to think about, well, my freedom is being kind of disturbed here. No, screw your freedom.
On Twitter, in the Philippines, the tone was just as rough. Some users said they didn't care if the unvaccinated died, just for choosing not to get the shot.
In the middle of the school year po ako magpapabakuna, yung mga side effects po, ang magkakos nun is magiging absent po ako, and napaka-importante po sa akin na hindi ako makakuha ng absence.
Kung nakasurvive ka naman ng wala pa yung vaccine, bakit ka pa magpapavaccine?
Depende po. Basta po kung babakunahan kami, sigurado na safe po talaga yung ibabakuna sa amin.
None of us on this side of the debate had any problem if you wanted to take the vaccine for yourself. The real issue was the attacks on those who didn't. People who, looking back, had good reasons to hesitate. They were vilified, demonized, punished, shunned socially, fined and fired from jobs, banned from gyms, and their kids were suspended from schools.
A number of people, for one reason or other, who just do not want to comply and get vaccinated. We've got to get them vaccinated. And hopefully they will do it willingly. If not, there will have to be things that will essentially put pressure on them, such as you're not going to work in this particular agency or institution, you're not going to be able to go to this college or this university unless, in fact, you get vaccinated. And I believe that once we start doing that, you will see more and more people willingly get vaccinated.
It wasn't just unfair, it was wrong, controlling, and dictator-like. And often, it wasn't about health. Often, it was about virtue signaling. Comprehensively brainwashed by Big Pharma's mass manipulation through media industrial complex. The woke left loves my body, my choice in matters of abortion, yet they flip the script when it comes time to forcing an undertested injection on others. For some, it was about fear fueled by rage. For others, it was all politics. The other side had to be wrong. People got hurt because of it. In 2025, it's only right to call out what happened in 2020 so it doesn't happen again. Any doctor or scientist who questioned the vaccines, including Luc Montagnier, the Nobel winner who co-discovered HIV, was shut down, discredited, publicly abused, or called a conspiracy nut, or worse, by every left-leaning mainstream media outlet receiving money from Big Pharma. Take Anderson Cooper on CNN. Every show during the pandemic would cut to ads starting with, "Brought to you by Pfizer." All.
Anderson Cooper 360. Brought to you by Pfizer. CNN Tonight. Brought to you by Pfizer.
While the content of the show, each show would aggressively and shamelessly endorse the use of the Pfizer vaccine.
There's more breaking news tonight. An advisory committee of the U.S. Food and Drug Administration has voted to recommend Pfizer's COVID vaccine for children ages 5 to 11 under emergency use.
That's fucked up. That's the fundamental definition of a conflict of interest. A fact made 100 times worse when you learn that the US is the only country in the world that allows Big Pharma to advertise on TV all the time. Every commercial, Super Bowls, in between TV shows, kids shows. Every other commercial is literally a pharma commercial. Oh, but could cause this. Oh, could cause death. Oh, call this number. Oh, may have this. Oh, it's disgusting. It's so disgusting.
What's the most controversial idea you believe?
I mean, I got vaccinated 3 times and I don't think I should have gotten vaccinated. I don't think it works in any way. It probably has all these bad side effects. And 3-4 years ago, that seemed too crazy and too unscientific for me to question the vaccines. And now that doesn't even seem controversial.
Yeah.
So before we get into all of our social media bullies, I want to go over the 4 biggest lies about the COVID vaccine. COVID lie number 1. Vaccines completely stop COVID-19 transmission. The reality, the DOH and the IATF promoted vaccines like Sinovac and AstraZeneca as a way to end the pandemic.
Pang-araw-araw natin ng mga nababakunahan, pataas na ho ng pataas, ito pong Sinovac na recipients natin for vaccination. Sa tingin ko nawala yung pag-aagam-agam dahil napatunayan naman ng bakunang ito na ito ay kayang pumasa sa standards ng WHO.
Implying near total prevention of the spread. Campaigns like "Check the Facts" suggested vaccines protected others directly. Studies showed vaccines reduced severity, but had limited impact on transmission, leading the public to confusion when the breakthroughs occurred. How many different versions did they have? Selling you the carrot on the stick. But their claim that the COVID-19 vaccines completely stop transmissions of the virus is fundamentally incorrect and misleading. While vaccines have been remarkably effective in reducing the risks of severe illness, hospitalization, and death from COVID-19, they absolutely did not provide sterilizing immunity that prevented all infections from the onward spread. This misconception stems from early public health messaging that emphasized vaccines as a tool to end the pandemic by building herd immunity. But scientific evidence has consistently shown that breakthrough infections where vaccinated individuals still get infected can occur. And these individuals may transmit the virus at a bit lower rate than unvaccinated people.
Does the COVID vaccine prevent transmission?
The COVID vaccine can reduce viral load in individuals who are...
Does it prevent transmission?
When you have reduced viral load, you will have reduced transmission.
But in other words, it doesn't prevent transmission. You can still transmit the virus if you've had the vaccine. In fact, there's been reduced ability to interfere with transmission over time. And what we found is the most recent one since Omicron is down around 16% reduction, if there is a reduction. Does the COVID vaccine reduce hospitalization for children under 18?
It can.
It doesn't. The statistics are inconclusive, and the reason you can't prove that it does is there's so few people under 18 that go to the hospital. The numbers are extraordinarily small. There's like 76 million kids under 18 in our country. 183 died, and a few thousand went to the hospital in 2020 and 2021. And since then, the numbers have dropped precipitously, and the idea and the issue needs to be discussed. But the COVID vaccine is not reducing hospitalization. It's not statistically significant. Does the COVID vaccine reduce the rate of death for children under 18?
It can.
Once again, it can. That's a ridiculous answer. No, it doesn't, and there is no statistical evidence that it does reduce the death rate. These are statistics. We've looked at it.
COVID vaccine lie number 2. Natural herd immunity is inferior to vaccine immunity. Let me take a second here. Reality, the DOH pushed vaccination for all, including recovered individuals, without acknowledging natural immunity. Studies showed robust, often superior immunity from prior infection, but this was ignored. Ignorance. The assertion that natural immunity is inferior to vaccine immunity is a misleading oversimplification that contradicts robust scientific evidence. By ignoring natural immunity and enforcing blanket mandates, the DOH exacerbated skepticism, mirroring Dengvaxia's crisis, failures in transparency and risk stratification. COVID vaccine lie number 3. Vaccines have no significant side effects. Alam na natin lahat yan. Katangahan lang yan.
Hospitals get any more overcrowded, they're going to have to make some very tough choices about who gets an ICU bed. That choice doesn't seem so tough to me. Vaccinated person having a heart attack? Yes, come right on in. We'll take care of you. Unvaccinated guy who gobbled horse goo? Rest in peace, Wheezy.
The whole world knows. Athletes are dying around the world right now that are in the best human possible shape. Top 1% of 1% of 1% of the world. And they're dying from heart diseases. They're dying from blood clots. This is near and dear to me because a lot of athletes, for us to compete, to travel the world, a lot of us were forced to take this jab. A lot of us were forced to get the passports that you guys wanted to push. You hurt a lot of people that are in great shape, man. That's hard to do. That means you did this on purpose. That means you need to pay for this shit. And I know history repeats itself. I've seen the videos, I've seen the masks worn, and I've seen how the government has done this before. No more. We have the internet, we have information. We share amongst ourselves now. We are citizens of the world. Iba na tong laban na to. Game on.
When the vaccines first came out, we were given misinformation about it at every turn. And actual questions about the vaccine that were valid were shut down at every turn. The geniuses at Pfizer would not be actively doing something to undermine public health. And if they did do something to undermine public health, then they would fix it. That's actually what I thought. Because I'm not an ideologue, I kept an open mind to what am I hearing? What are the news updates? And more we started to hear about vaccine injuries, which, okay, maybe that's rare. Maybe that person had something, maybe not, but then you hear more and more. And then you find out that they're being suppressed. And I am not somebody who's like, Pfizer's evil. I realize these drug companies give us a lot of drugs that save some lives. But in this lane, the entire system was working against us in some nefarious ways because they wanted mass vaccination. So they weren't giving the full information so people could truly give informed consent. So I got double vaxxed. And then I got a booster. Then I got COVID, of course. And then I went for my annual physical a couple months later. And for the first time in my 50 years, I showed up as having an autoimmune issue. And I was like, what's that about? I've never had that. No one in my family has that. And I went to the best rheumatologist in New York City. And I said, could this be because of the double vax booster and then COVID? And she said, yes. And now I've really done a 180 on it to where I personally wish I hadn't gotten any of the shots.
The DOH downplayed side effects, emphasizing safety. Global reports of issues like myocarditis with Pfizer or clots with AstraZeneca were drastically under-discussed in the Philippines, eroding trust when cases emerged. All around the world, same old song. With the CDC reporting cases preliminary in the males aged 12 to 24, years after the second dose, at the rates of about 1 to 10 per 100,000 doses, based on data through 2025. And July 2025 Nature study following up on outcome showing mild presentations in most but persistent myocardial injury in some via cardiac MRI. They don't even know that they're hurt until they get a cardiac MRI, is what they're saying. We haven't even talked about shedding. Fuck, man. While in February 2024, BMJ study across 8 countries confirmed elevated risks post first, second, and third doses. AstraZeneca admitted in 2024 court documents that TTS can occur rarely, aligning with earlier hematology guidelines and a multinational 2024 vaccine study evaluating adverse events across 10 sites, which noted TTS as a key safety signal, which was exacerbated by the 2016, 2017 Denvaxia controversy.
Sabi niya, yes, mama, nga hindi na daw siya madinggi. Yung palagpangpatay sa kanya.
Desidido ang pamilya Kulite na magsampa ng mga kaso sa lahat ng responsable sa pagturok ng Denvaxia kay Sandro.
Kailangan yung managot sa ginawa nyo. Ginawa nyong eksperimento yung mga batang katulad ng anak ko.
Sanofi's dengue vaccine was linked to an increased severe disease risk in the seronegative children, causing public outrage. Legal action, where according to the public health analysis, a dengue vaccine linked to child deaths caused a collapse in vaccine confidence, measles from 88% down to 40%, and leaving only 32% of the Filipinos initially wanting to accept the COVID-19 vaccines. DOH campaigns like Vacunanais and partnerships with UNICEF and Meta aimed to address misinformation via social media. But studies in the PLOS Global Public Health 2023 and BMJ Global Health 2021 found that under discussion of global side effects, coupled with brand new hesitancy, preference for Pfizer over AstraZeneca due to clot reports. COVID vaccine line number 4, the worst of them all. Children must get vaccinated to safely reopen schools. This policy contributed to one of the world's longest school closures, lasting over 2 years. They said 2 weeks until August 2022. This affects me directly today, being a coach at a school. Last year was probably, I think, the first full year of schools being back in session in person. Every kid, every child on this earth is different now. You basically took all of the world's children and locked them away for 2 years, 2.5 years, and told them to be scared of everybody and everything. And then you just opened the door and told them, oh, it's okay. The kids are confused. Nagtatanong sila every day, why, bakit, and they don't know why to this day. The children of the world are owed an explanation to why the adults of the world at the time were so retarded, and why they couldn't think of anything better, and why they were so panic-stricken, or come true and tell us how much you got paid to lock the world down. The claim stems from a June 2020 statement by the Philippine Department of Education, articulated by Education Secretary Lenore Briones, that in-person schooling would not resume until a vaccine was available, prioritizing children's safety amid the COVID-19 pandemic. At the time, the Philippines had reported approximately 22,474 cases and 1,011 deaths, with no vaccines yet developed globally. The policy reflected earlier pandemic caution as schools had been closed since March 2020. And the president, Rodrigo Duterte, enforced a no vaccine, no classes stance.
For this generation, wala na matapos na doktor pati engineer. Kasi hindi na wala ng aral. Laro na lang. Unless I am sure that they are really safe. It's useless to be talking about opening of classes. That's probably bad. Para sa akin, bakuna muna. Pag nandiyan ang bakuna, okay na.
This led to one of the world's longest school shutdowns in the history of man, with full in-person learning only to resume on August 22, 2022, for about 24 of the country's 47,000 public schools. Transitioning to a full face-to-face did not occur till November 2nd, 2022, for all 27 million registered students. The prolonged closure was driven by fears that children could spread the virus, particularly in multi-generational households, common in the Philippines where elderly or vulnerable relatives might be at risk. The policy suggested that pediatric vaccinations was essential to mitigate these risks, aligning with global uncertainties about the COVID-19 transmission in 2020. Policy implementation, pediatric vaccination, prioritization. By mid-2021, as vaccines became available, the government prioritized pediatric vaccination to facilitate safer reopenings. In October 2021, vaccination for children aged 12 to 17 began in select NCR region hospitals, expanding nationwide by November. By early 2022, this extended to ages 5 to 11, following recommendations from the Health Technology Assessment Council. Joint memoranda between Department of Education and DOH and its 2022 update emphasized screening in children's vaccination records to ensure compliance. Though vaccination was not strictly mandatory for enrollment, these measures implied that unvaccinated children posed a high risk, reinforcing the original claim. Contrary to the claim's implications of high risk, global and local data consistently showed that children faced low risk of severe COVID-19 outcomes. Key findings include global evidence. Children are as likely to contract COVID-19 as adults are, but are significantly less likely to require hospitalizations or die. Philippine context, children accounted for only 9% of the reported COVID-19 cases in the Philippines, with mild or asymptomatic presentations predominant. Severe outcomes were rare, particularly among primary school-aged children. This evidence suggests that policy's emphasis on pediatric vaccination as a prerequisite for reopening overstated the actual health risks to children. UNICEF and UNESCO reviews found that in-person schooling with protocols like masking and ventilation did not significantly drive community outbreaks. Secondary attack rates in schools were low, and household transmission from adults to children was more common than school-based spread. The Philippines extended school closures ending in August 2022, exacerbating a pre-existing education crisis with severe consequences for learning and equity. Kids can't even read today. Fuck, man. It tied into your other one where the kids can't read. Yeah. And it's fucked up, man, because there was a kid at my school and I asked him if he could write cursive. He's a kid, so he was embarrassed. And the only excuse he can come up with, man, why he didn't know cursive yet, because he missed it during the 2 years. And listen, this is a kid, huh? The kid told me that it's lazy for you to just write and not have to pick up the pen and put it down. Listen to that logic, huh? I talk to kids every day. Kids don't lie to you. Kids won't lie to you, man. Not when you're having a heart-to-heart with them. Not when it's about mom and dad, they're going to get in trouble. If you just ask them to talk to you about normal stuff, they won't lie to you. You can find out how long and how bad this has set the human race behind. It's bad, man. I hope you become part of the solution to help us fix this. A World Bank study reported that 90% of Filipino children suffered from learning poverty, inability to read and understand simple text by age 10, a rate worsened by closures. The impact on marginalized students. The digital divide, 57% of households lacked internet access in 2018, severely limiting remote learning effectiveness. This led to increased dropout risks, child labor, and early marriage, disproportionately affecting marginalized communities. UNICEF highlighted additional harms like mental distress and missed routine vaccinations. There we go again. Economic consequences, the National Economic Development Authority, they estimated a productivity loss of over 187 billion over 40 years due to educational disruptions, threatening the Philippines' own economy, which relies on skilled workers for remittances and outsourcing. The excitement of students like Sofia Makahilig, who returned to in-person classes after 2 years of Zoom, underscored the social and educational value of reopening, which had been delayed by the vaccination-centric policy. The claim that the children must be vaccinated to safely reopen schools was rooted in early pandemic caution, but overstated in the risk of COVID-19 to children and the school-based transmission. Today in 2025, we all know that COVID only killed you in 2020. If you were old, if you were fat, kids don't die from COVID. They never did. And as a result of our horrible decisions, your horrible decisions, to keep them out of schools has been devastating. And we can only hope that the preposterous decision to vaccinate them for literally no sensible reason whatsoever won't be catastrophic in 10 to 20 years' time. I just want to share some of the things that were said during the world's ugly time. 2 reasons, twofold I'm doing this. 1, to call you out, nang walang kwenta ang sinasabi mo. Number 2, maybe to help educate. My hope to educate would be that we as a species are not so gullible next time something like this happens. Because I promise you, something is going to happen. They've tried so many different vaccines and outbreaks already since COVID. Let's just keep a level head and make sure you watch what you say when you say it. This is from Lakay at Lakas ng Timog. Let's be clear. Everyone deserves to be vaccinated. Okay. Every single one of us. Okay. We deserve. No one is safe until all of us are safe. I agree. But not everyone deserves to be respected after all the shit they said about Sinovac and the government as a whole. Never forget their names and their faces. Remember, the truth was always right, Gago. I understand the sentiment. You were scared and you listened to everything else and you're like a mockingbird. Paulit-ulit ka lang without even thinking, researching, or understanding. Next time, do better, ha? Pasensya, ha? Tang-ina rin kasi. I can't read this, I'm sorry. It's like putol Tagalog. It's like Tagalog with slang.
Sabi niya, tangina rin kasi titigas ng mga ulo ng mga tao, libre na ang bakuna, ayaw magpabakuna. Inutil talaga ang ibang Pilipino, ayaw sumunod sa mga policy ng government. Tapos sa mga gagong anti-government, walang ginagawa kundi ang manisi, kahit bobo at walang alam sa pamamalakad sa loob.
Nagsisimula, nagmumura na. And then nagsasabi pa, tanga daw kami. Sa buong buhay mo, sino ba ang nagbibigay ng anything ay libre with no attachments? Sino? Meron kang kilala? Except maybe Jesus? Katangahan mo. Ano na? How do you feel now? Oh my God. You just believed everything they fed you, huh? Sorry, I'm sorry if you're not around anymore, but I'm still going to call out your texts and your tweets. To those who do not want it, well, for all I care, you can die anytime. President Duterte warns that Filipinos who refuse COVID-19 vaccines will be confined to their homes. AJ English! Oh, how'd that work out for the whole world, tanga? Golly, good luck to you, huh? I hope you don't teach nobody English to teach them how to speak as dumb as you are. And all that you said was ignorant. That gang bad boy ka daw, ha? Ang sinabi mo dito.
Kung ayaw niyo magpabakuna, wala kami magagawa. Pero wag niyong sabihin walang COVID-19 kasi hindi namin inimagine lahat ang namamatay. Puta pati anti-vaxxers naniniwala sa COVID-19. Ibang biohealthcare approaches lang ang nais nilang tahakin. Pwede ba?
I know. Sorry. I can't be mad at that one. That was an okay opinion. Opinion naman lang to eh.
Gago yung tito ko, anti-vaxxers na hindi naniniwala sa COVID. Makakalayo mo ang dahilan kung bakit magto 2 years na hindi pa rin back to normal ang Pilipinas.
Yun lang masasabi ko dito sa text na to. This guy is probably uneducated. How did the 2 years work out for you? And now, how are you feeling about your statement? Ano? Yung uncle mo, buhay pa ha?
Ayaw mag-risk na sumakay ng UV Express pero labas ng labas. Tangay na magpabakuna ka kasi takot na takot sa COVID pero anti-vaxxers. Di ko mag-gets yung logic ng utak.
Sobrang low IQ nito. Tao na to. Okay, Englishin ko to ha. Small space, dami tao, high transmission. Nasa labas ka, malawak, low transmission possibility. Big spaces versus small spaces. And I can't even believe you texted this, tanga. When I was growing up, there was something I was scared of growing up Filipino. And it was growing up na walang kwenta. Being Filipino and somebody calling you walang kwenta is a bad thing. Wala kang kwenta is a person, as a man, tagabuhat, to carry, to ask questions to talk to. Walang kwenta. Itong tao na to, ay walang kwenta. 100% sure. Like a lot of these people, like now that I'm looking back and reading these posts, I was so mad back in the day, but now when I'm reading these posts, I feel bad for you. Parang kawawa ka. Kawawa kayong lahat. I hope from then to now you've changed. At least your thought process, man.
Pinaka-maayos na pagpapaliwanag tungkol sa bakuna para sa akin ay nagmumula kay Dr. Maria Rosario. Tandaan, kahit anong brand pa ng bakuna yan, basta inaprubahan ng FDA o Food and Drug Administration, equal footing o pare-pareho ng effective at safe yan.
Joey De Leon, you're supposed to be smart and refined, ha? You've been in the public eye for a long time now. Maybe hindi mo lang talaga alam. Maybe you didn't know. But tong statement na to, ha, you use the FDA as your foothold for a source for approval. Nalaman natin during this whole BS, the FDA, the WHO, lahat sila walang pakialam, ha. You learned, or I hope that you learned, those are paid organizations who don't give a fuck about people, only profits. Sure, Joey De Leon, I apologize if my words are hurting or, maybe they're I don't know, out of place, maybe they're rough. This statement, I don't think was mean. You just believed in the system too much. So I hope, Kuya De Leon, that we do get to meet one day and I would love to talk to you about the system that's in place. Salamat po.
Alam niyo, buhay natin to, katawan natin to, dapat ingatan natin to. Yung injection po na to, yung Sinovac na yan, nagsimula ako kanina, mga 2:30, 3 o'clock, no? And then after daw ng 14 days, after 14 days, may 25% na ako na panlaban sa COVID. Is that right?
Sa moderate and severe na case ng COVID.
And death also.
And death, of course.
Of course. And then after ho ng 28 days, babalik ako ng May 11, another dose po, yung pangalawang injection po ng Sinovac. Yan, that's right. So another 14 days, meron ka ng total of 75%. Na 100% total after 14 days, meron ka ng 100%. Eka nga, yung katawan mo, na pwede ka ng
katangahan, gago, Willie, Revillame.
Eka nga, severe.
I don't even need to hear it anymore, man. Katangahan to. This is what was happening. This is the problem. You took people who were public figures, publicly known, who didn't know anything, and you put somebody here beside them with a script and says, say this. Tell them that you're doing this. Tell them that this is good. Tell them. Okay na to. I guess that's where you can say some people were like, ay, trabaho ko eh. Anong gagawin ko? Be a man. Have some balls. Stand up for what you believe in. And I would say you did stand up for what you believed in. But you didn't even know what the hell you were talking about. You were asking him, tama, di ba? Tama, di ba? Yung 14 days, 7 days, tama, di ba? And then babalik ako and then 25%, tama, di ba? Could you imagine me being in a fight? Coach, itong combination ha, jab, cross, sipa. Tama, di ba? Katangahan. Katangahan that I hope that we never ever repeat sa ating kababayan. Hindi naman tayo tanga. Hindi. We're not tanga. We love, we trust, and we believe. Sabihin ko to ha, sa buong mundo. And to everyone in the entire world who doesn't speak Tagalog. When something big does happen, take a second, take a deep breath, look around, pay attention, let the dust settle, take another deep breath, and think. Who, what, why, where, when. Pause, answer those questions, and then make informed decisions then. Don't do anything because people are giving away free shit, huh? That's the trap. And it's been long enough. I don't want to bag on Sir Willie. But kuya, I hope you never do this again. Kahit trabaho lang, ha? I don't care what network you work for. I don't care if you're a guy, girl, or whatever. Tao tayo lahat. We should all be helping each other and looking out for each other, not pointing fingers and making each other feel bad. Especially when no one really knows. And the experts didn't know shit and still don't know shit. When people say that the world was unprepared, they're not lying. We weren't prepared. We weren't prepared for lockdowns. We weren't prepared for hysteria. We weren't prepared for toilet paper shortages. We weren't prepared for a lot of things. I would say if we were to look at this in the win-loss column, the world lost on this one. We took a big L. We took a big L. The best thing we can do moving forward from every loss is to learn. We learned opening your mouth before you really knew what was going on is probably the worst thing you could do. Being mean to each other during those trying times was probably the worst thing that the world did to each other. We literally lost friends and family over this thing that no one really knew, and to this day still doesn't really understand. My most favorite takeaway from this, speaking with you and being here at PGMN, is now you don't see one side or the other side of the story. You see the whole damn story. You're going to see the good, the bad, and the ugly here. Let's talk more, be more kind to each other. Next time something like this happens, let's all help. My name is Brandon the Truth Vera, and we are proudly PGMN.